Hi, my name is Dr. Abbey Crook, and this is my treatment video for depressive and bipolar disorders. My client's name is Jason Halston. He's 37 years old, and his differential diagnosis is cyclothymic disorder. The primary diagnostic features for this disorder is cycling between depressive and hypomanic symptoms occur with this disorder but lack the severity of major depressive and hypomanic episodes. And also it must be symptomatic for at least 2 years. Jason's story is that he's a 37-year-old computer salesman who is seeking psychiatric consultation at the insistence of his wife. She told him that if he didn't figure out what his problems was, she was going to file for a divorce. And Jason says that the only reason why he is doing this is because he loves her so much he doesn't want to lose her, but he denies that there's anything wrong with him and that this is a waste of time. But he does admit that he does have good and bad days, but dismisses this because he says this is true for everyone. When asked to describe his good and bad days, he describes the bad days as sleeping 12 to 16 hours a day, a lack of energy, confidence, and motivations to do anything. He says he kind of feels like a zombie on these days. He says the most I'm up for is dragging myself out of bed and sitting in the recliner and watching TV all day long on his bad days. When he was asked how long these days last, he indicated, or how long he's been having these bad days, he indicates that he's been having them as long as he can remember. He explains that these episodes don't really last all that long, just 3 to 5 days, then the good days return. According to Jason, during the good days, he feels confident, very sociable. His thinking sharpens. And then when he was asked why his wife takes issues with him, he explains that when he's having good days, he sometimes may have too much to drink and smokes marijuana. And she's caught him cheating on her a few times. He admits that he actively sought to keep his cheating from his wife, and he rationalizes his cheating behavior, his secretiveness, by stating that women just can't keep their hands off of him because he's irresistible. He complains that his wife doesn't understand this obvious fact. He admits that he uses the alcohol and marijuana to help him sleep when he is in his good days. So the good days would last anywhere from 1 week to 1 month, but usually would end abruptly when he wakes up in the morning and now he's having a bad day. So in school, his grades reflected his mood. When his mood was up, he would make good grades. When his mood was down, he would do poorly in school. His teachers and parents believed that Jason was a bright kid, but just wasn't motivated to apply himself as much as he could. This pattern can also be seen in his job. When he is having bad days, it's not unusual for him to call in sick. When he does go to work on these bad days, his performance is lacking. When he's in his good day cycles, his confidence and charm seems to lead him to lots of sales. He does well at work. And although he is considered a charming man in many social cycles, he alienates friends when he's hostile and irritable. He typically accumulates social obligations during his bad days and takes care of them all at once on the days that he's doing good. So he saves it for his good days. His multi-axial diagnosis, axis 1 is cyclothymic disorder. Axis 2 and 3 is none. Axis 4, his relationship is in jeopardy and he's having work difficulties. And axis 5, his GAF is 60. And the theoretical perspectives, he has one biological perspective. The client's symptoms may be due to a genetic predisposition. Research has shown that people with this disorder have a family history of bipolar disorder, suicide, or alcohol dependency. A deficit of serotonin or norepinephrine may be involved, aiding to depression, or an excess of norepinephrine leading to hypomanic-like symptoms. And that's my video for bipolar and depressive disorder. All right, thank you. Have a good day.